In griffonia, the seeds of this plant from West Africa have very significant concentrations, between 6 to 14% of 5-HTP, along with other active ingredients. So this is a very good source, basically the main source that we're using with 5-HTP for griffonia evidence, no meta-analyses, reviews. Studies from 2015-2016 describe its pharmacological mechanism. However, there are works. This work seems to me to have been carried out in the fairly recent year, 2015-2016, where the entire mechanism of action, the pharmacological mechanism that griffonia has, is described. So it's pretty well established. However, even though we might feel that it's somewhat insufficient, on its own, we can still make use of it. And for that, I've shared this study published in 2016, which mentions that only about 1/3 of patients usually respond to serotonin reuptake inhibitors, those that inhibit the reuptake of serotonin. So there's a therapeutic ceiling where, well, we can't give more, we can't provide more medications, and we're a bit limited in terms of response. On the other hand, we know that 5-HTP by itself doesn't have good pharmacokinetics. So there's a therapeutic ceiling where, well, we can't give more, we can't provide medications, and we're a bit limited in terms of response. On the other hand, we know that 5-HTP by itself doesn't have good pharmacokinetics. And here, what you can see is that in untreated people, if, for example, I have this, let's metaphorically see it as a level of 3 units of serotonin, meaning it's the extracellular serotonin. If I add a serotonin transporter inhibitor, I now have 2 more levels. So I don't have a ceiling that would be 5 symbolic units of serotonin. However, if I combine the transporter inhibitor with a slow release 5-HTP, the combination of these two allows for better pharmacokinetics of 5-HTP, while also increasing the pharmacological ceiling of the drug, effectively doubling the amount of serotonin. Therefore, it could be concluded that the combined management of a natural substance, in this case a slow release 5-HTP, along with the medication, in this case a reuptake inhibitor, could be very interesting for improving all pharmacological parameters. St. John's wort, hypericum perforatum with its mystique, is very rich in various active ingredients, mainly a set that highlights hypericin and also hyperforin, now gaining attention as an active ingredient, along with other groups of active compounds. And hypericin and hyperforin work to increase the availability of neurotransmitters in the synaptic space through both MAO inhibition, which is monoamine oxidase inhibition, and also through SSRI action, which is selective serotonin reuptake inhibition. So it's commonly used for depression, although it's also indicated for mild to moderate cases. And basically, hypericin and hyperforin work to increase the availability of neurotransmitters in the synaptic space through both MAO inhibition, which is monoamine oxidase inhibition, and also through SSRI action, which is selective serotonin reuptake inhibition. So it's the typical plant we're using for treating depression, although it would also be indicated for mild and moderate cases, especially in major depression, where the situation changes. It would also be indicated for anxiety, night terrors, and neurovegetative disorders associated with menopause. Well, it's a plant with side effects 10 times less. I mean, it hardly has any side effects. It's fewer than medications. The economic cost is lower, and we can say that in the 90s, Germany, one of the leading countries in prescribing medicinal plants, 25% of antidepressant prescriptions were for St. John's wort. Even the American Medical Association recommended St. John's wort first for other antidepressants for mild to moderate depression. I think this is great, but it might have also made some people uncomfortable with so many medications, and it has put St. John's wort a bit in the spotlight. The studies are quite conclusive. In short, St. John's wort has a significantly better effect than a placebo, similar to antidepressant medications, causes fewer side effects than heterocyclic antidepressants, and slightly fewer side effects than selective serotonin reuptake inhibitors. Those studies on severe depression are inconsistent and confusing. One meta-analysis. Systematic review. There's a ton of evidence regarding St. John's wort. I also have to say that all these clinical studies are like this, as I mentioned before, as long as I correctly titrate and accurately determine the quality of the St. John's wort extract I'm using to be conclusive with the studies I've mentioned. So what determines the quality of a John's wort product? Basically, its concentration in hypericum. Notice that hypericum is the pigment that stains the plant, and the ancient Galician women knew this, that when their husbands and sons went out to fish and felt sad, they would collect the St. John's wort that grew in the Galician lands. They noticed that the St. John's wort plants that stained their hands more were more effective than those that didn't. Of course, because those that stained the hand more had higher concentration of hypericum, the royal. Spanish European pharmacopoeia itself already says that tractors should not contain less than 1% of hypericum content. And here, I want to summarize it for you. The recommended daily dosage in the WHO monograph is 2 to 4 grams of the herb daily, or, and I will explain this especially in my herbal medicine class, how to manage the milligrams and how it relates to the correct titration and standardization in this case of hypericum that a plant like St. John's wort should meet. So the maximum would basically be, for example, in 3 doses of 300 milligrams, which would be the maximum I can take in a day, because anything more should be prescribed by a doctor. The limit for hypericum should be around 0.7 milligrams of hypericum. Well, hypericum is what we're using as a marker for the pharmacological quality of St. John's wort, because hyperforin, being less stable, is much more difficult to standardize. Well, St. John's wort has some precautions. There isn't enough data on its safety during pregnancy and breastfeeding. It doesn't report negative effects on the doses we use regarding operating machinery. But we do need to be careful. Even though experiences have been conducted with high doses of St. John's wort, they were initially done with St. John's wort injected into HIV patients. High doses, due to the hypericum content, could be photosensitizing. That is to say, if I take a high concentration of hypericum, like 2001, and then go out in the sun, I could get spots on my skin. A few years ago, the Spanish Medicines Agency, due to a competitive mechanism with other drugs, specifically those related to liver cytochrome P, advised that St. John's wort shouldn't be taken, or at least that it interacts with anticonvulsants, other antidepressants, especially one with cyclosporin given to transplant patients, with oral contraceptives, antiarrhythmics, medications given to HIV patients, asthma medications, migraine medications, and anticoagulants. All of us need to be very cautious when it comes to this, and there are guidelines that have been established for it. Next, the next plant that has gained a lot of attention is saffron, which, although it has been popularly used as a sedative, antispasmodic, and anti-asthmatic, among other indications, current research has also focused on the central nervous system, especially regarding depression. Well, saffron has a color given by Crokin and a scent that comes from saffronal. Well, if you remember the theory of hemonomines, just like St. John's wort particularly focuses on inhibiting and ensuring an adequate concentration of serotonin, saffron covers these 3 neurotransmitters. So, in theory, it covers a slightly broader spectrum. This is because crocin inhibits the reuptake of dopamine and norepinephrine. while saffronol inhibits the reuptake of serotonin. Well, there's a meta-analysis that evaluates the effectiveness of saffron in moderate depression, which indicates that it is superior, as effective as a placebo, and not inferior to other antidepressants. In the corresponding monographic modules on the topic, the appropriate dosages will be established, which you have here based on the studies that have been conducted with saffron, the maximum limits, and basically the 30 milligrams daily of hydroalcoholic extracts that are usually used. They exist well. Finally, regarding these combinations, you can find a lot of commercial presentations. Some of them, for example, are very interesting because they can combine St. John's wort with saffron, which would cover all three monoamines along with other components. I'll leave it there with ellipsis. This presentation combines saffron with melatonin, which is especially interesting for people who have trouble falling asleep. For example, there are presentations that combine St. John's wort and/or saffron with 5-HTP or tryptophan, or very interesting combinations where, for instance, St. John's wort is combined with high-quality royal jelly, like 1 gram, which is also very interesting. And then, of course, all of this can be easily combined with what I call wildcards, because the supplements I haven't talked about today, like magnesium, B complex, or especially omega-3 fatty acids. You can find all of this available commercially. Finally, to give a nod to aromatherapy and its importance, in this study, you have the explanation of the pharmacological mechanism of an extraordinary essential oil for depression, which would be one of the lavenders we know in the form of essential oils, where it would also have an action against the serotonin transporters. I've put here a study on recent research regarding the use of essential oils, in this case lavender. The essential oil of lavender has a monograph from the European Medicines Agency, the EMA, and there are various clinical studies where, although the most suitable route for essential oils would be the olfactory route to treat depression and mood disorders, it could also be considered for oral use. And well, that's it. I hope this masterclass has at least helped you understand a bit more or see the possibilities that certain natural products have for treating basically mild to moderate depressive states. It doesn't cover major depression. And all of this, as I mentioned before, will be developed in much more detail in the corresponding module related to emotional disturbances, basically concerning depression. So, well, thank you very much to the Integrative Health School. It's been a pleasure being with you, and I hope to see you very soon.